I just recorded a whole video and then realized I had ointment on my nose the entire time. So we'll try this again. Sorry. Those of you who commented, sent me messages, all that good stuff about my tonsillectomy and my sinus surgery, thank you so much. I have taken it all in, absorbed it all in, consulted my surgeon from Houston who did my transsphenoidal resection of my pituitary adenoma and partial gland removal. Because of everything, because of how painful tonsillectomies can be, he recommended that I don't have the surgeries together. And as much as that's like a bummer for me, because I'm the type of person who like will literally walk through fire just to get to the other side. I think that's the smartest thing for me right now. I will be having, in about a month and a half, my nasal valve collapse repaired, and then my turbinates in my nose reduced in size. However they do that, I forget. Later on, I will get my tonsils out when I need them out. Hopefully it lasts me through the summer, and I can do it in the fall. I don't know, it's getting hard, and my sore throats are getting more intense, more frequent, more, anyway. The other update is that you might have noticed my face, I have a couple spots. I have MRSA. As you all know, in December 2024, I had my surgery, my big surgery, and 4 days later, I had the flu, pneumonia, and a sinus infection. They were able to diagnose the flu and the pneumonia with imaging and a test. The sinus infection, they could not test what kind of sinus infection because they could not get the correct swab up high enough, because you are not supposed to swab someone who has just had that surgery, at least not that high. No, they wouldn't even let me do this. It was intense. I struggled obviously with my sinuses for a very long time, and at the end of August, I saw a new ENT. My new ENT diagnosed a staph infection. So I treated the staph starting in early September. Earlier this year, I went back to my ENT because of my tonsil issues, and he noticed my other breathing issues. I'm not going to display it right now because of what's going on. He referred me to surgery. I saw the surgeon a week and a half ago, and I am going to have a few surgeries, like we talked about. A couple of days after I saw the surgeon, I had a scope. There were students in there. I don't think they gave me anything, I'm not saying that, but I had some pain in my face, and because I had just been to the ENT, I thought, well, maybe I'm just more irritated because I went to the doctor. That doesn't usually happen to me, but whatever. Sometimes that does happen. It's allergy season. But the pain started getting worse. I started getting a pimple that turned into this blood blister that started to pus. It was gross. I won't go into any further detail. My nose got really red, and the pain started to spread up and also down. So I'm looking at the camera to make sure I'm pointing right. So it was in my gums and my teeth, and then up here and all around. I sent a message to my doctor, but it got really bad. My parents were concerned, so I reached out to urgent care, and the urgent care doctor put me on antibiotics, some oral antibiotics as well as topical antibiotics. He said to keep an eye on it because I might need IV antibiotics, and I need to keep the cream on. I told him my nose keeps running it off. I'm having sinus issues. And my regular ENT got back to me, and he put me on a different antibiotic regimen, so I started that one instead of the other one. I have looked ridiculous. I will insert some photos. I look like a duck. I look like Snoopy. I look like Hannibal Lecter. I have been washing my hands. I have been using a surgical scrub that they use, the antimicrobial surgical scrub that they use before they stick your hand into your chest cavity, their hand into your chest cavity. I have been using gauze. I have been using surgical tape. I have been using band-aids. I have been using Germex. I have been using alcohol. I have been using hydrogen peroxide, facial cleanser. I have been using triple antibiotic ointment over the counter. I have been using the prescribed medications. I have been taping shit to my face. I've been wearing a mask. I wore gloves. It's been a disaster. Unfortunately, these infections can make you pretty sick pretty fast. I felt feverish. I felt really weak. I did not feel good. I'm starting to feel a little bit better, but even today, my brother, he something at the ball game today. There was like a field trip presentation for like weather, and he works in meteorology. So every year we go watch him like do this huge presentation in the stadium, affiliated with the university and a local news station, and it's really cool. I have always enjoyed it, but I felt really crummy, and today's my better day. Like, you know, now I've got like this spot here which concerns me, so I'm treating that one too. This spot is not a thing to worry about. They've been there a while, and they're not worried about it, but it's just something to watch. So it's like a skin thing. I feel like I wanted to share with you guys because I asked you guys for your advice, so that was my decision. Is I'm doing the surgeries separately, and I will do my tonsillectomy when I feel like I really can put it off no more and I've fully healed from my other surgeries. Also, I'm hoping that the MRSA is healed by the time my surgery is upon me. I was wondering the likelihood, if you're a doctor or a nurse or work in medicine, of like this have always been MRSA in my nose, like since December 2024, because they couldn't diagnose the sinus infection, they just knew there was one. And then my ENT looked at it and went, that's staph, and treated it, and the staph got better with the Bactroban, and then now it's MRSA. And MRSA is a type of staph, yes, so has it been MRSA the whole time? I feel like as soon as I schedule surgery, I get MRSA at the surgical site, and I just feel like it hits me in the chest. Sometimes, like, I can't win, and that's not true because I've had lots of wins, and I need to remind myself of that. It's a little bit like self-pity party to think that I haven't had any wins, but I also just feel down sometimes, and I was feeling so down the other day, I just wanted to cry. So anyway, I'm really glad I went on my walk. I'm really glad that I did get to see the weather thing. Go Cardinals, we won. I got to spend some time with my family. Probably gonna post this a million times, but here's something exploding and a cardinal clutching his heart. By the way, there was a countdown to that explosion, and he ran like right towards it. It was so funny.